Hello everybody, Dr. Joel Baumgartner here. I'm super excited to talk a little bit more about our upcoming mastermind in September. I wanted to kind of just touch base a little bit more on the orthopedic side of things and the regenerative training that we're going to be doing. It's going to be basically broken down into 3 days. The first day, which is Thursday, is the mastermind training. So that's a higher end day with more one-on-one attention for our mastermind attendees. And that day we're going to be focusing on the orthopedic side on the ankle. So we're going to be going into diagnosis of the ankle problems. We're going to be going on to the physical exam. We're going to be going diving into the anatomy, as well as how do I regenerate dysfunctional problems in the ankle. So some of the common diagnoses would be ankle arthritis, Achilles tendon issues, plantar fasciitis. So we're going to be going into a lot of the palpation-based diagnostic workup, as well as some palpation-based injections, and then using your ultrasound to take it to the next level to get more accurate with your cellular delivery. And then on Friday and Saturday is going to be the summit. And the summit, we're going to be focusing on those 2 days with our cadaver-based breakout sessions as well on the knee and the hip. People always think, oh, the knee and hip is so basic. But it's really not. There's so much overlapping tissue there, so many overlapping ligaments. Now we're seeing there's so many fascial planes overlapping, especially around the hip and the pelvis, that can affect hip degeneration and breakdown, as well as different pain patterns. So we're going to really dive into, again, diagnosing the problem, getting the right workup, the right physical examination. How do you ultrasound evaluate the area to make sure you're looking for the pathology? How do you use the ultrasound combined with palpation-based injections to inject that area of the body, whether it's the hip or the knee, to make sure you're getting all those structures with that tensegrity model that are causing that area to break down and get the pathology. So usually the pathology is not the hip arthritis. It's what's happening around in the spine, and the pelvis, and the muscles and the fascia around that area. So it's going to be great. We're going to learn a lot, but you're going to be able to go home with very practical skills to make the lives of your patients better. We're also going to be having an additional option too on those days over the weekend, is to do a bone marrow course as well, where we're going to teach you how to do a very safe, very effective way to extract bone marrow if you're taking stem cells into your practice and going to that next level of regenerative treatment. So very excited about what's happening with orthopedics. We're also having, on top of that, our business part of our summit is saying, how do I take all these things and incorporate this into my practice? How do I make my practice make sense so I can come out of this not being so dependent on myself, but having a practice that works for me? So we're going to teach you a lot of business systems and incorporating new cash flow practices into your current practice, how to make your practice more lean and efficient, how to market, all those really critical things so you can get awesome patients in the door, so you can practice the skills that you have as well. So we are definitely welcoming you, but also welcoming anybody of your staff that might be the business, the administrators in your practice as well, to come and learn that aspect as well, so you can really make your practice thrive. So we'll see you guys at the end of summer, beautiful September here in Minnesota.